So at this ASCO meeting, we will have the opportunity to see results of very interesting studies. And in fact, some of them phase 3 randomized trial resulting in new standards of care. The first one I would like to emphasize is the OPTIMISMM trial. This is a phase 3 randomized trial conducted in relapsed and refractory myeloma patients previously exposed to proteasome inhibitor and previously exposed to lenalidomide that were randomized to receive bortezomib and dexamethasone versus pomalidomide plus bortezomib and dexamethasone. And the addition of pomalidomide, the immunomodulatory drug, to bortezomib and dexamethasone resulted into a significant prolongation of the progression-free survival, 11.2 versus 7 months, and especially when this combination was evaluated in patients in first relapse, patients that were coming from lenalidomide as part of the first line of therapy. I think that the superiority is even more evident, and the median progression-free survival was of approximately 20.7 months. In addition, so the safety profile for this combination is good, and so I can summarize that pomalidomide, bortezomib, and dexamethasone will be a new standard of care to use in relapsed and refractory myeloma patients. Another interesting presentation is coming from one combination based on carfilzomib, but with daratumumab, the CD38 monoclonal antibody. And this combination has been evaluated in a phase 1b study in no more than 100 patients, but this combination resulted also very effective, especially in patients lenalidomide refractory. So the most interesting situation for these trials is that these combinations have been evaluated in a more realistic population, so in patients that we see every day in our clinic, patients exposed to proteasome inhibitor, exposed to lenalidomide, and most of them lenalidomide refractory. And we are going to have the opportunity to see like carfilzomib in combination with daratumumab resulted also very effective in terms of overall response rate, complete response rate, as well as also progression-free survival, specifically in this patient population lenalidomide refractory. Finally, we will have also the opportunity to see the final results of a couple of trials conducted with Pembrolizumab, the checkpoint inhibitor, one of them in combination with pomalidomide and dexamethasone in relapsed and refractory myeloma patient, and the other one in combination with lenalidomide and dexamethasone in non-transplant eligible newly diagnosed myeloma patients. So both trials were halted by FDA approximately 1 year ago because there was observed a not favorable risk-benefit for patients included in this trial. There was observed a disbalance in the number of deaths in both arms, resulting in a high frequency of deaths in the arms of patients receiving Pembrolizumab in combination with Lendex or in combination with pomalidomide and dexamethasone. So this was the reason why the trials were halted. However, we have to know that these combinations were based on checkpoint inhibitors, on immunotherapy approaches, and sometimes we needed to wait longer follow-up in order to really see what is the benefit of these combinations. So the early termination of both studies does not allow us to reach consolidated conclusions. And we can say only, for example, in the KEYNOTE-183 study, in which Pomdex was compared with Pomdex plus Pembrolizumab, that a significantly higher proportion of patients with high-risk features were allocated to the experimental arm. More elderly patients, more patients with high-risk cytogenetic abnormalities, even with extramedullary disease. So I think that we can't reach consolidated conclusions because due to the early termination. But we hope that these checkpoint inhibitors can be potentially reutilized for the treatment of relapsed and refractory myeloma patients.